Welcome to my YouTube channel Pharma Life. Please do like, share, subscribe my channel. Hello friends, in the previous video we have discussed about the methanol poisoning. In today's video we'll be discussing about ethanol poisoning. And firstly we have to start with synonyms. Ethanol synonyms include ethyl alcohol, grain alcohol. Coming to physical appearance, it is a clear, colorless liquid with faint sweety odor and sweetest burning taste. It is both water soluble and lipid soluble. Sources of ethanol production. Ethanol is mostly produced by synthetic production of ethylene. So by ethylene will mostly produce ethanol, and by fermentation of sugar, cellulose, starch, and by enzymatic hydrolysis of cellulose. So beverage alcohol is mostly produced by the fermentation of the sugar with yeast. Uses of ethanol. Ethanol is popularly used as beverages. Popular alcoholic beverages include beer, wine, whiskey, gin, brandy, rum, vodka, etc. So here I mentioned about the ethanol content in various alcoholic beverages like light beer. It contains only 4 to 6% of alcohol content. Heavy beer contains 6 to 8%. Natural wine contain only 2 to 3%, which is the less ethanol content present in all the alcoholic beverages. Fortified wine contains 10 to 20. Whiskey, gin, brandy contains 40 to 45. Rum contains 40 to 50%. Liqueurs contain 70 to 50. So ethanol is not only used as alcoholic beverages, it has also used as solvent for mouthwashes and perfumes. Ethanol has medicinal uses like it in several antihistamine, decongestants, multivitamin, cough syrups. It contains varying percentage of alcohol, like it varies from 2 to 25%. Have antiseptic property. Surgical spirit nowadays we are using contains 90 to 95% of ethanol with 5 to 10% of methanol. So ethanol sponging is effective remedy for hypothermia. Hypothermia condition can be treated by ethanol sponging, and it is a antidote for methanol and ethylene glycol. I already mentioned in the previous video. For methanol poisoning we'll use ethanol, as ethanol has same will be metabolized with the same enzyme known as alcohol dehydrogenase. So it will be used as antidote for methanol and ethylene glycol. It is used as rectified spirit. It is used as preservative. Like rectified spirit is mostly used as preservatives in chemical analysis. It is used as fuel. So ethanol is used to extract nucleic acid from tissues. And coming to the fatal dose equals to 550 ml or 2 pits ante equal to 1 quart. It is approximately 1100 ml of strong distilled spirit like whiskey, which contains more ethanol content. If we consume that strong distilled spirit within a short span, it will be lethal to us. For adults, 6 grams per kg is fatal dose, and for children 3 grams per kg of ethanol is fatal. So toxicokinetics. Toxicokinetics means how the ethanol is metabolized, how it is absorbed. Ethanol is toxic by oral inhalation, subcutaneous, intravenous, intraperitoneal and dermal routes. It is rapidly absorbed from stomach. 20% of absorption takes from stomach and 80% of absorption takes from small intestine. The peak plasma concentration reaches within 30 to 90 minutes after consumption of last dose. So factors that delay absorption include presence of food or delayed gastric emptying or presence of congeners with alcohol. All this may be the factors that delay the alcohol absorption. Vaporized absorption causes faster intoxication. Intoxication means the substance used to make us loss of consciousness. Man and woman consumes an equivalent dose. Women shows the high blood concentration of alcohol than men, because women has less alcohol dehydrogenase enzyme. So women shows more alcohol blood concentration. That's why the liver damage happens with women who consumes small quantity of alcohol only. 90% of ethanol that we consume get metabolized in the liver. Only 5 to 10% of ethanol get excreted as unchanged form by kidneys, lungs and sweat. Excretion of ethanol by lungs follows Henry's law. Henry's law is nothing but the ratio between concentration of ethanol in alveolar air and the blood is constant. Metabolism of alcohol in the liver takes place by three pathways: alcohol dehydrogenase pathway, microsomal ethanol oxidizing system, peroxidase catalase system. Alcohol dehydrogenase pathway takes place in the cytosol. In this, ethanol is converted to acetaldehyde. Acetaldehyde is converted to acetic acid, and acetic acid is converted to acetyl CoA. Acetyl CoA further enters the Krebs cycle and it gets converted into carbon dioxide and water. Ethanol to acetaldehyde conversion is taken place by an enzyme known as alcohol dehydrogenase, and acetaldehyde to acetic acid taken place by an enzyme known as aldehyde dehydrogenase. Microsomal ethanol oxidizing system takes place in the endoplasmic reticulum. It occurs when the ethanol use is chronic. It has the ability to stimulate the microsomal ethanol oxidizing system. This leads to the interaction between ethanol and other drugs that metabolize through this system. Because of this, the T-half of several drugs get like phenytoin, tolbutamine, isoniazid and warfarin get shortened because of the accelerated metabolism. So chronic ethanol abuse is the potential reason for paracetamol hepatotoxicity. Peroxidase catalase system takes place in the hepatic peroxisomes. Average rate of ethanol metabolism. Occasional drinkers has 100 to 125 mg per kg per hour. Habitual drinkers have 100 to 175 mg kg per hour. Mode of action. Ethanol acts by enhancing GABA aminobutyric acid neurological function through interaction with GABA A receptors and chloride ion channels. This theory is not convinced by all, and the second theory appears to be more convincing, that it reacts with N-methyl D-aspartate ligand gated and glutamate receptors.